So with OsteoGen, it was looking for a product that was going to solve the inadequacies that I was seeing with my conventional grafting materials that I had learned in school and learned in residency. In my residency program, we were very bovine based with our grafting materials, and when I got into doing implant therapy, two of the problems that would come up was one that I had to wait greater than 6 months usually in order to come back and to place an implant. And then many times when I did come back in on re-entry, I ended up finding grafting granules that were not turned over, granules that were encapsulated with connective tissue. And it was a problem that I wasn't sure how to solve. I moved from there to allograft materials, and that helped tremendously from what I was seeing in bovine-based graft materials. But I then wanted to try to find something that I knew was going to be not only predictable, but was also going to be easy for me to use, and that I could do treatment affordably and very quickly. And part of that was due to the fact that many times in private practice, in the general practice side of things, we're jumping from chair to chair to chair, and that puts time constraints on our treatment. We don't want to provide treatment that is not up to the level that we want, but what we want is products that are going to accomplish things that are on par with other products or better at a faster rate, either a faster rate of being able to do the actual procedure or a faster rate of being able to come back and do a secondary procedure. That's the reasons that I kind of jumped into things, and I was looking for a better mousetrap, basically. With your background, I mean, what in your mind is the ideal grafting material? If you were to just explain it to your grandmother or your father who doesn't have a dental background, what would be the way that you would express what you really want out of a material?
I think for me, will be something that I know it will lead to true regeneration. Because I think as a specialist, a lot of the patients that come to us, they come because they know that either they had an unfortunate experience or they had a complication, or whether, they have different expectations in terms of, some of the biomaterials that we're using are a little bit more diverse compared to some of the, local general dentists that they just have access to one or two. They know that when they come to us, we have a variety. And I mean by that we can also tailor based on their religious consideration, based on their all these other preferences that they might have. So I think it's kind of like a balance between making sure that we can achieve true regeneration and will serve very well as a future site development for a future implant. Okay. Right. And then from there, I think we also have to marry that to who is our patient, because, we see all these diverse patients. And especially, apart from my office, which I'm very happy you came to visit today.
Yeah, beautiful office.
Thank you, in downtown Boston. I also teach at the university, right? So, some of those patients, they do have financial limitations. So I feel like it's almost, I have to look at it as a trifecta, has to achieve oral regeneration, has to meet the expectations of the patient, but also cost is important because not everybody is able to afford the fee-for-service practice.
Right.
So I have to kind of like look at all of those things. So I think for me that's very important at this point. And when you're looking at, the ideal bone graft, of course, when you're looking at apart from achieving oral regeneration and all of those things, you can't spend too much time. So it has to be pretty easy to use.
Right.
In the clinical setting. It has to be easy for my students as well and for my residents, because some of them, they take like 2 hours to complete an extraction. So it's kind of like 11:30. The session finishes at 12.
Right.
So sometimes they don't have enough time to, put the bone graft and the membrane. So, it has to be something that is easy to handle for them. And then for me, I look at more like chair time valuation, right? And it's kind of like, okay, how much time does it take me to do this? And so I think there are a couple of factors that we have to be mindful of. And I feel like as our field is evolving, I think we're looking much more beyond just like the clinical result and the x-ray. We have to look at other things as well, right?